My name is Dr. Cate Varney. I'm a UVA physician and I am the Obesity Medicine Director at UVA. So childhood and teen obesity is a big problem because it leads and puts them at higher risk of things like diabetes, heart disease, non-alcoholic fatty liver disease. We know that the longer people are exposed to these diseases, the more impact and severity that it has on them, and it can shorten their lives.
I'm a type 1 diabetic, and so since the youngest of ages, health has always been a part of my well-being and being able to function. And as I grew up, I learned that it's actually a part of everybody's well-being, and it really makes a true difference in a person's life if they are healthy, and it changes the way we interact with the world around us.
If we don't act now, we're going to be in the place that we are with adults, and we cannot as a society have this many children and adults with obesity. Our healthcare system will collapse.
Yeah, I've been concerned about it since I started teaching 15 years ago. I'm heartened that there are so many opportunities that are coming about, but I think that it definitely needs to be on the forefront of the community's mind. It's something that has to be a culture change where we're giving opportunities to every student equitably. So taking away those barriers that are stopping some families to be able to get, high quality physical education.
We know that socioeconomic factors play a role in this. And it's kind of ironic, but those at greatest risk of having increased rates of obesity are those that are living in what we call a food desert. So what is a food desert? It's basically an area where there's not access to a lot of grocery stores, there's not access to fresh fruits and vegetables. So you're thinking, okay, wait, they have less access to food, less calories, right? They should be less weight, but that's not what we find. Those are the ones at greatest risk for obesity. So one of the things that we can ask our schools to do, make really good choices for the kids that, depend on the free and reduced meals at school, breakfast, lunch. Make them nutritious, make them cut the really highly processed foods out of them, get sugar-sweet beverages out of the schools, but also, increasing activity. Is 30 minutes of PE a day in school good for kids? They could be doing more.
Every PE teacher in Charlottesville City Schools teaches the physical education SOLs and they teach the health SOLs. And so there is entire sections of our standards of learning that are dedicated to eating healthy, exercising, getting good sleep, but specifically nutrition. They do follow the MyPlate guidelines so that we're kind of all on the same page. And then there's lots of programs within the school, like the healthy fruits and vegetable snacks. We have school gardens. There's actually urban gardening classes at Buford Middle School and at the Charlottesville High School.
We know that children had an increase of weight during the pandemic, just like adults. We saw that. There was one study that looked at over 400,000 children ages 2 to 19, and we saw that their BMI nearly doubled during that period of time compared to pre-pandemic.
The pandemic kind of entered in the phase of needing to be on screens more. Like it was really important so that we could engage in learning and continue to commune together even though we had to be separate. But unfortunately that added in a lot of sedentary habits that are really hard to break.
The causes of obesity during the pandemic are hypothesized to be 3 things: a disrupted sleep cycle, change in nutrition and how they were eating, and then also a decrease in activity, either through organized sports that were shut down or PE for kids that were doing virtual options and didn't have that opportunity to have PE class. I think the thing that parents need to focus on most for those that are starting to have kids that are gaining weight or showing signs of obesity is not to focus so much on the weight and the numbers, but focus on the healthy habits. Getting your kids to, stop watching TV and get off of their electronics and shove them outside and make them more active. Engaging them in healthy choices with food options, helping them prepare meals.
I really appreciate any and all effort of people coming together to help our students and our children to grow up and to be healthy, because they deserve not only a healthy world, but a healthy body in the world.